What is occupational therapy? So, in order to answer what occupational therapy is, we have to first talk about what is occupation. So, occupation is all the things that you do that occupy your time. So, think about your daily routine from the moment you wake up to the moment you go to bed. There is physical, cognitive, emotional, spiritual aspects of every single activity that we do throughout the day. No matter what region, no matter where you live in life, no matter what happens, there's always something that leads you to do something, to have something, some activity to be done. It could be something as simple as putting on a shirt. It could be something as complex as driving. And so occupations are all of those things that you do. They're meaningful, they're purposeful, and they basically get you from point A to point B. They have some sort of mission. Maybe they're completely meaningless, but they have something to them, some sort of aspect to them. So yes, every single thing that you do throughout the day, that is an occupation. People get us confused, occupational therapists, because they think we just rehabilitate people's back to work. That is not what we do. It's way more complex than that. So, now that we've defined what occupation is, or at least have a general idea of what it is, what is occupational therapy? Occupational therapy is a form of rehabilitation medicine where you get people back to doing those occupations, the one I just mentioned. Now, like I said, getting people back to doing those things that they normally do throughout the day, the things that they do that they love, it's very complex because there's so many factors that can be involved in that. Oftentimes, and keep in mind, this can be done at any age group, from birth all the way to old age to when you're about to die, so hospice care. And like I said, there's physical factors, there's cognitive factors, there's emotional factors, there's spiritual factors, there's political factors, economic factors, cultural factors. There's a gambit of different aspects to why people do the things they do. Their own identity also can contribute to how people can perform their occupations. And so having to break down each and every single one of those aspects, that's what we do as OTs in order to optimize it, to find either some modification or to get people to rehabilitate their own physicality back to doing those things that they love. So as an occupational therapist, I work in a number of places throughout the lifespan or throughout the setting. So we don't only just work in hospitals and skilled nursing facilities. That is two of the places we work at, but we also work in school settings. We work out in the community. Some of us go into private practice. My big push is social media, because I recognize how the power of social media and the internet and getting a voice out there to people, millions of people, super important. It's super optimized in that way. But we'll get more into that in a separate video. So yes, back to occupational therapy. So it's done from birth all the way to elderly. So let's see, what else do I want to say about this? And here's the thing, no two therapists are the same. I would say the demographics of occupational therapy are they're challenging right now. Unfortunately, I think it's 80 to 85% of occupational therapists in America are white women, and most of our patient population is way more diverse than that. So I think putting a diverse face in a role like this is super important, because they can end up I know that it's important to have the people who have merit. That's true. And also merit comes in many different forms and many different different races and ethnicities and genders. So I think the idea of just only having a select few people be in this profession has been really detrimental to it. So as a black man in America and a black male doctor in America, and also a doctor of occupational therapy, I think it's really important to put my face out there so that other black men out there can say, you know what, this can be a profession I want to get into as well. So yeah, and I think I'll do a video on my credentials, and we'll talk about that next.